Welcome back. Overdose by opioids affected more than 2,000 Hoosiers just last year, and though the number is still going down from previous years, experts still stress the importance of protecting Hoosiers. And now, an online training program is seeking to reduce these deaths by recruiting, also training everyday Hoosiers. And research associate Chris Henderson joining me now on the old blue couch to share more about the program. Chris, good morning to you.
Good morning.
All right, first and foremost, tell us the name of the program and how's it basically helping to fight overdoses?
So the Citizen Opioid Responders Program, or CORE program, is an online naloxone training program meant to engage more of the public in overdose prevention efforts. So this really empowers people to not only learn a life-saving skill like administering naloxone, but more importantly, it helps people feel more confident, ready, willing, and able to render aid.
Okay, so we're going to kind of talk about that. Obviously, some of the other benefits of going through the training. You mentioned saving lives, but also additional benefits as well.
So an additional benefit would be that the accessibility, right? So it's an online naloxone training program, so it doesn't matter where you're at. You can access this training program from your home, from your tablet, a desktop, a cell phone. We've made it really easy for people to complete the training program. It takes the average person about 20 to 30 minutes to complete. Everybody earns a certificate of completion. And also, we've given a lot of thought to this training program in that it's not enough to just get people trained. We also want to link them to free naloxone in their community. So we've built that out as well. We've provided them a free resource to locate Narcan.
Yeah, I'm just curious, who can go through this training? Are there any types of, folks who can't, or maybe age restrictions or something like that?
No, in fact, it's open to anyone to take the training. Through a recent funding opportunity, we've been able to expand the training program across Indiana to 5 IU campuses and also 3 additional counties. And so what I mean by that is like IU Indy, IU Bloomington, IU Columbus, Fort Wayne, and also Southeast. But then the additional counties include Clark, Floyd, and Monroe counties. We also recognize that people are going to learn about this training program that are near and adjacent to those universities, and we welcome people in those communities completing the training program.
I remember when it first came out, just talking about naloxone, and people are going, what is that? Should people even have that? But now I think we've kind of transitioned into the fact that you want to really normalize carrying naloxone.
Yeah, so keep in mind, right, that there's a lot of misinformation and misunderstandings around substance use disorder, but more importantly, also around Narcan and why we should have it. This training program really helps to normalize being trained in overdose prevention, and also the importance of carrying it, just like it's important to be trained in CPR, or rescue breathing, or first aid. So we want people to feel comfortable. Keep in mind, the leading cause of death in this country for people that are 18 years of age to 45 is accidental overdose.
Oh, wow.
So, and majority of those are linked to synthetic, so fentanyl. But also, elderly people take too much medication. Children get into medicine cabinets and take things that they shouldn't. And then if you're a college campus, you may, on a college campus, you may unknowingly take something that is unsafe. And so we want to normalize through this training program the importance of getting trained and carrying it, and therefore increase the likelihood that people will be nearby and feel confident and ready to administer.
Yeah, far from affecting just one or maybe 2 groups, but so many different ones. So if you'd like to know more about the community impact of this program or sign up yourself, you can head to fox59.com/links for all the details. Chris, thanks for being here. We do appreciate it.
Thank you. Appreciate it.
Well done.